Good evening. This is the North Andover Board of Health virtual meeting, Thursday, August the 27th, 2020. I'm Joe McCarthy, the board chairman, and let's have a roll call, starting with board members. Michelle Davis.
I am here.
Daphne LaFleur.
Hello, everyone.
And also department members. Brian LaGrasse, the director. He's here, trust me.
Sorry, I'm here. I was on mute.
Stephen Casey, the health inspector.
Yep, I'm here.
And also Tony Wilfordham, the department assistants.
Present.
Okay. So I call the meeting to order. It's about 7 o'clock. And before proceeding, the governor's comment on open meetings must be read in its entirety. So this will take me a few minutes, so please bear with me. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, GLC 30A, Section 18, and the governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the North Andover Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found on the town's website at www.northandoverma.gov. For this meeting, members of the public who wish to watch the meeting may do so on their televisions by tuning to Comcast Channel 8 or Verizon Channel 26, or online at www.northandovercam.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately assess the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the Town of North Andover website in audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. If the public would like to participate in public hearings, please email your comments prior to or during the meeting to blagras at northandoverma.gov. That is BLAGRASSE at northandoverma.gov. The comment will be read during the proceedings and responded to accordingly. Approval of the minutes. Michelle?
I have reviewed, I believe we are reviewing 2 sets of minutes, the previous 2 meetings tonight. Do you want to do one at a time or both at the same time?
Are you talking about the June 25th and the July 23rd?
Yes.
Yep.
Yeah, that they're ready to be signed off on?
They are both approved. So we have, or they are both reviewed and ready to be approved.
Okay, is there a motion for approval? Daphne,
I can
Michelle?
make a motion. Yep, I can make a motion to.
Sorry, I was muted. Motion to approve the minutes.
I will
Okay.
second.
Okay, all those in favor say aye.
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 Okay, then the minutes of the 2 meetings have been approved. Before I turn it over to Brian to talk about for an update on mosquitoes and the COVID-19, and as those that are listening in and those that are participating in the meeting right now, the focus since the coronavirus has been what is happening in our town. And as such, Brian and his people will be speaking further about that in just a moment. But first, I want to thank Deanna Lima, the Community Support Coordinator, for her discussion on the impact of COVID-19 on mental health, and for a review of her discussion and other relevant information, because she did speak at our last Board of Health meeting on July the 23rd. Just go online, the town's website, and all this, there's simply a wealth of information. It's absolutely amazing how much information is available on our town website. So if you have any interest in what she and others had to say, go online and find out. And at that, Brian, I'm going to turn the meeting over to you and your staff.
Thank you very much. I definitely appreciate Kim, Robin, and Bill for attending our meeting tonight. Looking to get a quick update on mosquito control and virus testing and virus hits around the state. If you guys can just give us a quick rundown on what's going on, we'd be very appreciative. So I'll turn it over to you guys.
Kim, do you want to talk about what's going on with
Sure.
collection?
Yeah, I could do a quick summary on the just mosquito surveillance and what the district is seeing so far.
Okay.
So for 2020, the district's total mosquito collections are down 70% from 2019's totals. Our total Culicida melanura collections are down 77% from last year. And of course, the Culicida melanura species is the one responsible for the initial transmission bird to bird of Eastern equine encephalitis. We're also down 70% of that same mosquito from our 5-year average. So our populations of the Culicida melanura for Triple E are extremely low in the district.
That's great to hear.
Of course, since on 8/13, we were called as a significant drought conditions, a level 2 declared by EEA for all the Commonwealth, with the Northeast region also experiencing a classic long-term drought. According to the Northeast Regional Climate Center, our district falls between 50 to 75% of normal precipitation from May 2020 to August 2020. So our district is extremely dry, which does coincide with our low Culicida melanura numbers, and subsequently our lower district's mosquito numbers, as well as our spring larviciding attempts that we did in those habitats, and as well as some other places that we focused on in preparation for what we were thinking would be for us a busy Triple E season again. North Andover's mosquito collections are, although we're down, you're up 147% from last year, but that's only for the cattail mosquito. It's a cattail that lives, it's a mosquito that lives in cattail areas. And this year they came out fairly early and the numbers were pretty high. And this was before the actual drought. So they came out at the end of July. And then after that, all mosquito populations dropped significantly. Your total mosquito populations compared to 2019 of other mosquitoes were really low. So you guys, we collected hardly any melanura at all. In fact, none. We did send in 14 mosquito pools for testing, but those were from our gravid traps, which were mostly Culex pipiens and restuans, which are responsible for West Nile virus. And then I sent in whatever we could for the perturbans to see if we could get anything for Triple E. All your mosquito pools that we sent in so far have been negative for West Nile virus or Triple E, and the populations have dropped to the point where we're scrounging to collect things just to send in. So that's a good sign too. I can let Bill elaborate on this further, but we completed all your catch basin treatments, and this is of course for West Nile virus prevention, on 8/5. So on August 5th, all 3,645 of your municipal basins were treated. We did have one resident request for inspection to inspect their property. And we did complete 29 regular larval site inspections this spring with treatment for spring brood mosquitoes and for Triple E mosquitoes. And that's kind of a summary. So.
Awesome. Thank you so much. I wasn't sure how this year was going to turn out with everything going on in the really early hit of Triple E in, was it in Barnstable area back in June. Do you guys remember that?
Oh, yeah. I mean, there have been a lot of Triple E all over the state besides our district. We had one West Nile virus mosquito pool from Revere last week. And we sent in quite a bit this week from the southern part of our district, which would be the Winthrop, Revere, Lynn, Nahant area. And all
Okay.
those came back negative for West Nile virus. So our response in Revere, we collected nothing to send in after the positive. We did our emergency response, and we had nothing to send in this week for them. But everything else that we sent was negative. But for the rest of the state, there's been quite a bit of EEE activity in other districts to the west and to the south.
Okay.
Bristol, Plymouth, Norfolk, and now they've also seen West Nile virus come up too. But yeah, there's been a couple human cases, but nothing for our district.
Okay, great.
I just want to add too that there was an aerial spray done down in Bristol and Plymouth counties back on August 10th, and it encompassed 179,000 acres in one night. They did with 3 airplanes, and that was due to they had some quite a spike in cases down there. They had a couple, I believe, a couple human cases from that area. But a lot of mosquito pools that tested positive for EEE. So hence the aerial spray that the state did. They had talked about another spray within 2 weeks to piggyback on top of that to help cut the numbers even further, but I haven't heard any word about that as of late. Nothing also, I guess early in the season, we had something from, I think, Wendell, Mass, which is out Pioneer Valley area, and also Orange. And I believe nothing has transpired further in that area also. So the big hot spot we all know is the Hockomock Swamp down in Plymouth and Bristol counties. And that's pretty much a given every year. They're going to get virus from that. It's like a penetrable swamp. They've tried to do some air sprays over it with granular early in the season to try to knock things down, but it's really hard to control. You can't walk in there. It's thousands of acres too, which makes it even tougher. So we consider ourselves lucky in that respect, that we have small pockets of areas that can produce EEE, but this spring, like Kim touched on a little bit, we focused on some of those areas to treat, and along with the drought. I mean, the drought for us is a good thing. It kind of started with no snow melt in the early spring. The crew was finding woodland pools dried up very early in the season, which we didn't know if that would last, but it seems to have had, and we're still at a significantly below where we should be for our water table, which again, mosquito wise is good, but bad in a lot of other aspects, for water supplies. I know, Brian, we have barrier spraying scheduled next week. I think Tuesday or Wednesday with you.
Okay.
We'll know better about the weather come Monday. I think Barry's going to be in touch with you, our field foreman. We had planned to do some more barrier spraying tonight to finish up Andover, but with the weather the way it is, it's at my house right now. Before the meeting, I looked and it was 57 degrees here. So it was getting kind of cool and showery too. So it's not a good scenario to do any spraying in that kind of weather. So I don't know if Kim or Robin have anything else to add or at this point.
Just one thing, Brian, if you can send me a list of the schools and parks that you want sprayed next week.
Yep.
So we can coordinate. I can reach out to the IPM coordinators again to get the plans updated to make sure they have all our materials.
Okay. Yeah, I sent an email to the superintendent the other day after you sent the second one around, just to get that taken care of.
Okay.
So hopefully we get that done. I appreciate your time, you guys. Looking forward to working with you guys again, as always. If you need anything, give me a call. Thanks thanks for joining our virtual meeting tonight. We're just having to come down to town hall like last time. I look forward to getting the spraying done next week. So thanks, Bill.
Bill, I
Yeah.
have a couple of quick questions. You said spray of 179,000 acres. I think it's around 400 square miles. How effective is such spraying?
DPH does testing prior to the spray and then after the spray. And also the two mosquito districts down there, Plymouth County and Bristol County, they trap like through the spray itself, prior, during, and after. And their numbers drop considerably. I don't know, there hasn't been a report published yet about it. It will be out shortly. For the efficacy to know what the percentage of the kill was, what they reduced the population by. But you're right, it is originally the area that was targeted was like 202,000 acres, but with some no spray exemptions and water bodies that they don't spray over, it was about 179,000 acres. In the past, when they've done spraying like that, they get a decent kill. I want to say, I really don't know what the percentage is, because it depends on mosquitoes prior and then what they get after the spray. So it's hard for me to say, not knowing or trying to. I don't want to try to guess.
And they also focus on habitat with that too. So they ask the districts prior, like this year, right? I think last year, at the end of the year and this year, early spring, they asked most of the districts where they thought their at-risk populations for mosquitoes were in the various districts, and to map them and send them to them. So once we all did that, they pretty much knew where to target some of these large acreage sprays.
I recently read that annual deaths from mosquito-borne ailments, about 1 million people. Of course, the vast majority of them are in Africa and Asia, but that's a very, very large number, to say the least. And fortunately, it's pretty much in control in our country. Not completely, but comparatively speaking, pretty much in control. Also, too, and I know it's when we talk about diseases, ailments, and so forth, Lyme disease is not to be underestimated. It's about 45,000 cases a year in this country. And I know quite a few people that have come down with Lyme disease over the years, and it can be quite debilitating and even worse. So the bottom line is, when you're outside, when you're in the woods, like I own a small farm here in North Andover, and even when it's hot in the summertime, I wear dungarees and long sleeve shirts. And boy, I just spray. DEET is very effective. I just spray myself because I've had some physiological problems. I'm not a young man anymore, and I just don't want to come down with Lyme disease or any mosquito-borne ailment at all. So just be careful when you're outside. For those that are listening,
we take precautions. Our crew, has mosquito spray with DEET typically. That's effective against ticks. But yeah, we're very, very diligent about it and very aware that the habitat that we operate in is, can produce Lyme disease. Some years are worse than others, but we're constantly aware of that. It is a debilitating disease, and my family members of my own had Lyme disease, so I know firsthand that it can be brutal.
well, again, just be careful, everyone.
Kim, Bill, Robin, thank you guys for joining our meeting tonight. We definitely appreciate it.
Yeah.
I look forward to talking to you soon.
Thank you for having
Okay.
us. Have a good evening.
Brian.
All right, thanks.
Thank you,
Bye.
Brian.
Thank you.
We'll be in
Thank
touch
you.
the first of the week.
Okay. All right, Joe, what do we got next?
All yours again, Brian.
All right. So let's see, just give you guys a quick little update on our COVID-19 stuff. Obviously, there's a lot going on here with general enforcement, keeping tabs on everything, working with all the different departments in town. But things are moving along. Things are going well. We are in phase 3, still in step 1. A couple weeks ago, the governor did roll back the gathering numbers for outside venues from 100 down to 50. So that's a little wrinkle. He saw a little blip up in the numbers, so he rolled that back to try to help curb any additional spikes, which it seems to have worked. The numbers we have look really good. Currently, Mass is doing fantastic compared to other parts of the country. In Massachusetts, we had a total of 365 new cases today, but that's out of 25,340 tests. This month, the month of August, the state ranged from 162 cases to 438 positive cases per day, but the testing capacity has grown substantially over the last month or so. Our testing numbers per day range from 12,000 to 27,000 tests being done in Massachusetts per day. A month ago, we were probably about 10 to 12,000, maybe up to 15 or 16 in a few days here and there. But so we've kind of done a good chunk of additional testing and testing capacity. Right now, we're at a 1% testing rate, which is the best we've seen in the entire pandemic. This month, the public health metrics that we look at and the state uses for implementing new orders or guidance or guidelines is doing really well. We have 6 categories. We just went from 3 in the green to 4 in the green, and 2 are still in the yellow. The green categories are positive test rate, number of patients in hospitals diagnosed with COVID-19, testing capacity, and contact tracing capabilities. The 2 categories still in the yellow, which means they're in progress of improving, is the numbers of deaths per day and healthcare system readiness. I don't know if that'll ever get to the green, but they've been working on that for a long time. Currently, we have 5 cases in town. Those 5 cases are on isolation. We have 338 people who've recovered. And basically, our incident rate in town here is at 1.2 people per 100,000. So that is a really good number. I'm definitely happy to see that. We've been working on this for a long time. It's been 6 months. When this all first started, our positive test rate was at 30%. Now we're down to 1%. I think that's a huge step in the right direction. Obviously, as things reopen, people fear for spikes and things like that. So we've been working a lot with the school department and getting their plans ready to have them reopen the schools safely. They have adopted the hybrid model. I don't know if you guys heard the school committee meetings. I've been participating in those a little bit. They adopted the hybrid model, which is basically they divided the classrooms into two cohorts or 2 groups, an A and a B cohort. Each group will go to school 2 days per week, and everyone does 1 remote day. So cohort A is going to go on Mondays and Thursdays. Cohort B will go on Tuesdays and Fridays, and everybody does remote learning on Wednesdays. All the classrooms have been modified for spacing and spacing requirements. Busing is different this year. They're going to have assigned seats, and they're arranged completely differently in terms of where students can sit. New cleaning protocols and schedules have been put into place. The HVAC for each school building is being inspected and tested and commissioned by an engineering company. Actually, last week, Melissa, some school committee members, selectmen, and myself and school department personnel rode the school bus from the administration building over to the Franklin School, as the students would do. And we basically played student for a little while, went in through into the school buses, into lines, into the school, sat down in the classrooms, and then talked about all the stuff that they were working on and all the stuff they've implemented, which is really good. Very well thought out, very detailed, and I think they came up with a great plan to do school safely. The state has also created a rapid response testing unit. So when schools are back in session, if there are any clusters or outbreaks, the state can send a mobile unit up here to do rapid testing for school staff faculty, students, things like that. So that's something they've been working on, and they're going to be able to implement. The state also increased their Stop the Spread testing sites from, I think last month when we talked, it was 8. We now have 20 across the state. Methuen and Lawrence both have testing sites. So there's a very local and very easy to get to. It's free. The Methuen, I think, is at an AFC, as well as at Greater Lawrence Family Health Center in Methuen on Pelham Street. And then Lawrence General has it, as well as the Greater Lawrence Family Health Center. So you can find those numbers online. You can call, make an appointment. You can walk up and just go there and get tested. I think testing capacity and contact tracing is one of the keys to basically monitoring and stopping the spread as much as possible. Merrimack College is actually back in school now. They started their reopening plans, and we worked with their administration for the past few months on all the stuff they wanted to implement, all the changes, all of the physical barriers they put up, student protocols, and their testing plans. The town manager, Melissa, and Mayor Rivera and myself toured the campus with Andrew Mailer and his team. He was in charge of the COVID operations for Merrimack College, and they did extensive changes over there. They implemented a ton of changes in terms of student living and dining, food service, classrooms, things like that. So they actually also implemented a weekly testing program for every student, staff member, and faculty at Merrimack. That's going to be 4,500 tests per week. They are mandatory, and they started before they came back to school. Before Merrimack College students moved back onto campus, Northern was doing under 2,000 tests per week for the entire town in terms of residents being tested. Merrimack's doing 4,500 just on campus. So we've more than doubled our testing capacity in town here. We've also met with Brooks and their health team over there and been working with them on their reopening plans. Their students will be coming back, I believe, next week. And they basically going to isolate as a school bubble. All students are living on campus. There are no day students anymore. All the day students have been set up with places to live on campus, so they don't have to leave. Let's see. Town hall is actually open by appointment only. That's new. The library is also open with limited capacity and also has curbside pickup. And as I said, the governor did reduce the outside gathering limits from 100 down to 50. So I worked with Stevens Estate on their plans over there because they had some weddings coming up that were capped at 100. Now they had to reduce those down to 50. Not sure when we're going to get into step 2 of phase 3. I think the numbers are looking good, but obviously with schools coming back online, 70% of the schools in Massachusetts will be hybrid, 30% will be remote. One can only anticipate that there will be clusters, there will be some spikes, the numbers may go back up because of more people being out and about. So that may hold off step 2 of phase 3 for a little bit longer, but we'll see how that progresses as the data comes in. So slowly opening, the testing capacity is ramping up right at the right time. The governor had talked about the testing capacity being up to 70,000 tests per day by December. We're halfway there. We'll see what we can do. But that's where we are right now. So I'll let Stephen give his update. Caroline's on vacation this week, a well-deserved and well-needed vacation. I took a week off as well a couple weeks ago, which was very needed. Let's see. And Stephen, I'm going to pass off to you. You can give the board an update on what you've been doing and everything like that. So I'll take any questions after Stephen does his inspector update.
All right. So I've been working with restaurants still just to give them feedback. Some of them have pretty much just been trying to be proactive because obviously with the weather in New England, outdoor dining is going to have to come to an end at some point. Once it gets too cold, some of them are going to have their tents go away too. And they've been looking for feedback and just information on using barriers for their indoor seating, because that's something you can use if you have tables or seats that are just, you can't maintain a 6-foot distance between. So like booths, for example. I'm trying to work on setting up a Zoom call as well with the restaurants, just as a refresher before the weather really gets bad with Megan Baldwin and Bridget Sweet Safe, to give the restaurants like I mentioned, a refresher basically, and just go over some of the COVID guidance for restaurants related to indoor seating. We've also had some restaurants doing remodeling and a new restaurant being constructed in town. So I've been working with them just to make sure that they're doing everything per code. The complaints in general have slowed down a little bit. Most of the complaints we've been getting when this first started were mask complaints, and they were related to people actually working at the establishments in town or employees. Now more of them have been a little more geared towards customers, but again, they've dropped down as a whole in total. So just as a reminder, if you are going into like a retail store, a grocery store, a restaurant, etc., just so make sure you guys are wearing a face covering and keeping your distance. And on that topic as well, we still have PPE kits available for businesses in town. So if you're having a tough time getting masks, you can always reach out to us. You can get up to, I think it's 300 masks and a couple of bottles of hand sanitizer just to kind of hold you over until you can get more. And then some of the more normal inspections and more typical stuff has been coming up again. So septic is still chugging along. I've been doing housing inspections. A lot of the pools, which I talked about in the last meeting, are up and running, and I haven't gotten any complaints so far with them. So that seems to be going well. And then I've also just been working with people like caterers or temporary food vendors on permitting and just making sure that they're following any guidance related to COVID-19 when they do events at places like Smolak Farms or, like Ryan mentioned, the Stevens Estate. I worked a little bit with Brooks on their kitchen layout and food service for when kids come back to campus. They reached out to me probably like a couple weeks ago, and I went over there and did a site visit and just tried to give them the best feedback I could. And then we've also just been pretty much working on getting ready for some of the permits that are going to be coming towards the fall and winter. But that's about it for me. So.
Thanks, Steve.
Steve, this is a Joe. And by the way, the review of Brian and Steve was very good, as always. I know that unlike New Hampshire and Massachusetts, you can't sit at a bar. But at the 99 restaurant here at the Andover, they have, and I was there several days ago, they have small tables attached to the bar. And so they're at least 6 feet apart, and they can provide seating for maybe an additional 15 people. It's really ingenious. So they're at the bar, but they're not at the bar. They're at a small table that's attached to the bar. And speaking of restaurants, and this is to you, Brian, or to Steve, have any in North Andover temporarily or permanently closed because of the coronavirus?
As far as I know, Fuddruckers is closed.
Yeah.
They closed a couple of months ago, so it may have been in direct relation to coronavirus, or the fact that Merrimack College closed back in March, and all of their student body left campus, which was a big part of their business because it's so close and it's right there. Tony, can you think of anything else?
Off the top of my head, I think the only place I knew that closed, because there were some that closed for like a period of time just to, I think, kind of figure out exactly what they were going to be doing and adapt to the regulations and the guidance coming out from the state. One that had closed, but I think it was a little before the pandemic started, was the Wine Lab. But they've actually done a little remodeling and rebranding, and they should be opening within the next week or so, which is good to see. But I can't think of any off the top of my head that have kind of shut the doors for good so far, which is good to hear.
Yep. So it's going to be a Tavern on High, correct?
Yep. Over
All
on
right.
High Street.
Yep. Okay.
And usually before our meetings, I get together with members of the department to review information and such. So more often than not, I know the answer, but I'd rather have the department members explain because they're certainly more knowledgeable than I am. And Brian, you mentioned that the school schedule, but that's only 3 days a week per student.
Correct.
What are they going to do during the other 2 days a week? Do they have assignments? What's happening?
I assume they'll have homework to do, but people are going to be responsible for finding childcare, tutors, A lot of people are getting together with their friends and families and getting together pods of kids to basically be taken care of on those off days. There's only so much homework they can give, so I'm not sure how much it'll be done. Obviously, it depends on the grade. But yeah, so 2 days in school learning, 1 day remote, and then 2 days your family's gonna have to find something to do.
And how long will this be going for? Is there a feeling, an estimate right now?
There is no estimate. They can scale up or scale back, however they need to, depending on clusters, outbreaks, safety issues, and the spread of the virus. So if things go well and it's very limited in terms of spreading or clusters, and the teachers feel safe, the kids feel safe, if the mitigation factors that they are implementing work, such as the social distancing, the mask wearing, the hygiene protocols, the cleaning schedules, if those work and there's very little risk, then the schools will open up more. If there's outbreaks and there's issues, then they can scale back and do more remote and less in-person learning. So I'm going to wait and see how that goes.
Several other quick comments and questions, and then at that time, Michelle and Daphne may have input. You mentioned that public gatherings, the number has been reduced. Does that affect churches at all?
Churches have their own sector-specific guidance, which caps them at 40% of their maximum occupancy.
So public gatherings, the number you say reduced from 100 to 50, it has nothing to do with churches per se.
Correct.
Okay. Also, preparing for this meeting, I was reviewing last month's meeting notes, and at that time, the positive test rate for the coronavirus was 1.8%, and now, as you said, Brian, it's 1.1%. So that is good news. You also said that the numbers of death per day is, is somewhat of a concern. Well, it's always a concern when there's a death, of course, and concern with health system readiness. But I just wonder, putting this together, we went from the second part of phase 3 back to the first part of phase 3, and yet a lot of these numbers look very good. So to scratch my head about that, I really can't comment further, but it is what it is. And again, we do take a guidance from the state. Daphne, Michelle, do you have comments at all? Hello?
This is Michelle. I just want to, I just want to say I've been listening to a lot of the school committee meetings on TV, and just wanted to thank the entire department for all their hard work and everything that's been going on. I know that there has been hours and hours of meetings and being available to help with that planning. And again, on top of everything else that the department has done through all of this, which is tremendous. I know that has been yet another lift over the past month or so. So just wanted to thank everybody for all of that. And you know, being a parent of North Andover children who are preparing to go back to school, I just want to thank you for all you're doing to help, you know, educate and inform parents as well on what's going on, so that they can make the best decision for them.
Awesome. Thanks, Michelle. I appreciate that.
I have absolutely no comments. Just I know just one thing that I want to share. We're all in this together, and it's all uncertainty. We never thought 2020 would be like that, and just I know the board and everyone in town has been doing an awesome job. So just again, just to echo what Michelle said, just thank you for all that you guys are doing.
Thanks, Daphne, and thank you for all your help too. You've been fabulous in this.
I appreciate you guys.
Yes.
Yeah, and amongst things that Daphne has done, I mean, she was instrumental in involving We Care charities to help seniors in our town in need, and that is another source of needed and much appreciated food. And And I know that without going into details of this particular time, there's more that Daphne is going to do from a personal and family perspective. And Daphne, thank you. Thank you very, very much for all that.
No, you're quite welcome. I'm excited. And that's all we can do at this time, especially seniors and children to me are close to my heart. And that's all we can do is just be there for them in this time.
Okay. On the coronavirus, you know, I'm as an engineer, I'm pretty much a numbers man, and I want to share with all of you some numbers that you may or may not be aware of. No one under the age of 20 has died from this virus in Massachusetts. Perhaps that information is dated, but it is no more than, I got that recently. The average age of death is 86. I had read 81, then I read 82, and then I read 86 from this virus. For people under 80 and in good health, and I will reiterate that, and in good health, the survival rate from this virus is in excess of 99%. So what our country, what our state has done so far, I feel has been warranted. Going forward, I'm very concerned about the catastrophic effect and consequences that this is going to have in and on our economy, particularly if the numbers spike up later this year. They're talking about the GDP in our country going down in excess of 8% this year. That's huge. Keep our fingers crossed, and I hope that there was a treatment for this in a shot. I know that there are some treatments that are being looked at very closely right now. For example, plasma transfer, remdesivir, dexamethasone, and I was hoping to speak with Dr. Scanlon, who's very, very good on matters as such. But rest assured that we'll have a conversation at our next meeting on all of that and more. Anything else, Brian?
Yeah, one update I forgot to mention, the governor did make flu vaccine for school-age children mandatory. So everybody going to school has to get a flu shot, whether it's a in-person learning or a remote learning, everybody has to get it. So I've been talking to a couple of the pediatricians' offices already. We're trying to figure out how to get this done with the amount of patients that they have and the amount of vaccine that's out there available. Not going to happen right away, but we're going to try to figure out how to best do it and working with each other. So Andover Pediatrics and North Andover Pediatrics, we're hoping to maybe even meet next week to come up with some ideas. Our family flu clinic, we are planning for next month or in October, will be a drive-through versus in the auditorium or gymnasium as it's been in the past. So we're working on that now. We've got some models to work off of, and we're going to see how this goes. It's going to be very interesting and definitely different than in years past.
Brian, repeat that again, please, on the flu shot. The governor's going to make it mandatory.
The governor made it mandatory for school-age children or people going to school.
Some of them aren't going to take it. Some of them and their parents just aren't going to do it. What's going to happen to them? Any idea?
I have no idea. This just came out last week, so we're going to try to figure it out and kind of go from there.
I also read that a substantial segment of the populace will not take a shot for the coronavirus when it becomes available. So,
okay.
So this ought to be quite
very interesting.
Yeah. And by the way, this past week, actually the last several weeks, amongst other things, Brian and I were talking about maybe getting someone from the Mass Health Department to join us in monthly and sometimes more frequent than that Board of Health meetings, just to talk about what the state is doing and why they are doing it. What is the genesis of some of this? And I'm not saying that there isn't a genesis, but I really want to know more because of what this is doing to our economy. And unfortunately, correct me if I'm mistaken, Brian, but you have not been able to get anyone to join us
Not
so
yet.
far. Yeah.
Not yet.
That's disturbing. It really is. I mean, we don't want to berate anyone or give anyone a hard time. We just want to have a chat with them. But hopefully, we'll be able to do that sometime in the future.
Okay. I'll work on that.
Yeah. And also, there are only 4 members of our board right now. We do have an opening, and hopefully, our next meeting we will have a 5th. We will see.
Yep.
So.
Awesome.
Is there anything else?
That is all that we have. We are holding firm over here with our orders and getting everything we can get done, keeping the department afloat. Stephen, Tony, Caroline have been amazing. It's been a long stretch for the past 6 months, but we're chipping away at it. So thank you guys. Appreciate it.
Well, that goes for you too, Brian. I'm very impressed, as is everyone that I know, with you and your department and what you've done for our town. We know that this has not been easy. This is a rough time, and hopefully it'll be coming to an end in the not too distant future.
Okay.
So,
With
is that
being
it?
said,
That being said, we need a motion.
I make a motion.
To go ahead, Michelle.
Go for it. I'll second.
Motion to end the meeting.
There's a
Second.
second?
Yes.
All those in favor say aye.
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 awesome.
The meeting is over. Thank you and have a good evening.
Thank
Thank
you,
you. Good
everyone.
evening, everyone.
Thanks, everybody.
Thank
And
you.
again, you can turn it off. We're good. And
Thank
we're going to
you.
do lunch next week, right, Joe?
Excuse me?
We're going to do lunch next week?
Oh, absolutely.